healthy, decent, safe place for people to live.
Walkable communities.
Quiet, peaceful environment.
I mean, I feel safe in this community.
Families flourish in an environment that's healthy.
We take pride in where we live, and that pride is going out throughout the neighborhood.
We know environments, community environments, have a major impact on behavior, and that what people see around them have a major impact on their health.
For example, we went to the doctor a while ago, probably about 2 months ago, and my doctor said to my daughter, I don't see any refills on your albuterol. What's going on? How's your asthma? Well, we've lived here 2 years and my daughter's asthma is almost non-existent.
The health aspects of this are so very important is because the population that utilizes affordable housing has been so vulnerable to health issues in other housing that they may have occupied.
Minnesota Green Communities is a collaboration of the Greater Minnesota Housing Fund, the Family Housing Fund, and Enterprise. And we're working to make all the affordable housing in Minnesota energy efficient, healthy, and affordable.
The basic principles are build housing where it is well located in terms of public transportation, well located in terms of jobs, build housing that encourages active lifestyles, walking, community participation, and it includes using the techniques that reduce the energy consumption of the individual units.
Well, our joint goal that we share was to make all affordable housing in Minnesota green. And so 5 years ago, we began to encourage affordable housing to be built green through pilot projects, demonstration projects, and incentive funding and technical assistance, and succeeded at having several hundred units of affordable housing get built as green and healthy.
Some discussions of green don't include healthy housing as within a broader, more comprehensive definition. Our criteria do, and I think that makes them far more impactful.
Just to give you an example of how important green and healthy housing is throughout Greater Minnesota, we've got projects that are built to the green standards and that were the initial pilot projects for healthy housing in Duluth and Worthington and Mankato and other cities throughout Greater Minnesota. In Southwest Minnesota, there's an organization called Southwest Minnesota Housing Partnership led by Rick Goodyman and a wonderful team of staff who are dedicated to building affordable housing, and they have embraced building green and healthy housing and have done a wonderful project in Worthington.
And what's really cool about the project is that it is a rehabilitation project. So we took a project that was blighted, had very little useful life left, and made some significant reinvestment in the property and did it from a green, healthy housing perspective. We're seeing fairly significant health impacts, less childhood illness, definite improvements in reduction of respiratory illnesses, and on the livable side, the buildings are much more comfortable. There's very little evidence of any mold and mildew, and much better ventilation, and much lower energy costs.
When you live in a very good area, a very good house, you get healthy. Better to be healthy than be rich.
While we've got this policy adopted now where all affordable housing will be built green and healthy, in the future, what we need to do is we need to make sure that that quality is achieved and that goal is actually achieved. We still have work to do. We still have a ways to go in terms of making sure that this goal is realized in all of its potential.
That work has influenced our policies around how we implement green in all of our projects. We were at a point before Green Communities where we were just talking about energy efficiency, thinking about how we might do that. Well, now we have overlays and criteria that require green community standards in all the projects that we do.
Healthy housing means that children have less asthma complications, less, other health complications. And that can be boiled down to economics. But economics isn't the whole story. The quality of life, the happiness and the health of a family, the ability of a family to enjoy each other and to become strong members of the community all hinges on their health. And so in order to have healthy communities, we have to start with healthy homes.